Hello, my name is Nick Sadeghi, and I'm going to be speaking about atorvastatin. Atorvastatin is also known as Lipitor, its brand name. It belongs to a family of drugs known as statins. It's used as a medication to treat cholesterol levels, and it works at a basic level by blocking an enzyme that's involved in the body's synthesis of cholesterol. Indication and administration. So atorvastatin has been approved by the FDA for uses in hypercholesterolemia, familial hypercholesterolemia, hyperlipoproteinemia, hypertriglyceridemia, as well as prophylaxis for risk of cardiovascular event, and that might be to multiple risk factors for coronary heart disease, type 2 diabetes, secondary prophylaxis, and then it's also used off-label for CV event risk prophylaxis like above, but specifically for PCI, also chronic heart failure, atherosclerosis, and for basic administration, we're going to be taking this by mouth with or without food. So some common side effects patients might run into while taking atorvastatin are GI related, like diarrhea, musculoskeletal, like mild arthralgia or soreness of the joints, or myalgia, soreness of the muscles, renal side effects like UTIs, respiratory side effects like nasopharyngitis, and also some mild pain in the extremities. These are more serious side effects that if patients run into, they need to contact their primary care right away, or if very serious, they need to call 911 immediately. And these could be hepatic effects like severely elevated liver levels, which are going to be found in a hospital setting, or signs and symptoms of hepatotoxicity or liver failure. And then the big thing with statins is muscle-related effects. So we want patients to be aware of symptoms of myalgia, myopathy, tendon rupture, because these all could be early signs of rhabdomyolysis. Mechanism of action. Atorvastatin is a competitive inhibitor of hmg-coa reductase. hmg-coa reductase is an enzyme that works to convert hmg-coa to mevalonate, which is the rate-limiting step in the biosynthesis of cholesterol. It's been shown to lower total cholesterol, LDL cholesterol, triglycerides, all while raising HDL cholesterol, which is the good cholesterol. Dosage. So atorvastatin can be found in generic form as well as brand under the name Lipitor. It's offered in oral tablet coming in 10, 20, 40, and 80 milligrams. At the two higher doses, the 40 and 80 milligram, this statin now is considered a high-intensity statin, and that means it can lower the LDL cholesterol by approximately 50% or more. Dosage recommendations. So starting with primary hypercholesterolemia, mixed dyslipidemia, or hyperlipoproteinemia, initially patients are going to start at 10 or 20 milligrams by mouth once daily, or 40 milligrams once daily if greater than a 45% reduction in LDL is needed. And that's with individualized dosage with a range of 10 to 80 milligrams once daily. We're going to need to assess the lipid levels within 2 to 4 weeks of initiation or titrations of doses. For cardiovascular event prophylaxis, we're going to follow the above protocol, but factoring in whether we need medium or high intensity. And that's based on how much we need to lower the LDL levels. If we're lowering from 30 to 49%, 10 or 20 milligrams once daily by mouth, or if we need more than 50%, 80 milligrams once daily by mouth, and titrate down if unable to tolerate. It's also important to note that using medications with atorvastatin for treating dyslipidemia, we need to consider benefit versus risk and consider using a lower starting and maintenance doses of atorvastatin. Dosage adjustments. So for renal failure patients, no adjustment is necessary, but for hepatic insufficiency, this medication is contraindicated in patients with active liver disease. For geriatric populations, we have to pay special caution as advanced age is a predisposing factor for myopathy. Age-related changes to hepatic metabolism may also result in changes in pharmacokinetics. Here are some warnings and precautions to use with atorvastatin. Diabetes mellitus. So statins can increase levels of A1C as well as fasting blood glucose. Hepatotoxicity, myopathy and rhabdomyolysis, hepatic impairment and high alcohol use, myasthenia gravis, stroke, and this medication is a 3A4 substrate, so we need to avoid using with strong inhibitors or strong inducers. Contraindications. So any hypersensitivity to atorvastatin or any component in the formulation is a strong contraindication, of course. Any active liver disease, unexplained persistent elevations of liver enzymes, pregnancy and breastfeeding, concomitant use of cyclosporin, danazol, gemfibrozil, red yeast rice, and like I said before, this medication is a 3A4 substrate, so caution with 3A4 inhibitors. These ones listed below are contraindicated because these are strong inhibitors. Monitoring. As with any statin, lipid levels are going to have to be pulled 2 to 4 weeks after initiation and 2 to 4 weeks after any adjustments to the dose. And for toxicity, liver function tests before initiation and as indicated thereafter. These are especially important with patients with liver disease or high alcohol use. Also, we need to be aware of any signs and symptoms of myopathy. Here are my references. Thank you so much.